Duvan Zapata has suffered a very serious knee injury, and it looks like sources have in fact confirmed that he is dealing with a torn ACL and meniscus, which is unfortunately going to sideline him for the remainder of the season. In the injury video, we see that as he plants with his affected leg, this is going to cause that knee to go into something known as a dynamic knee valgus position, and also show us a couple other things where it looks like we see the exact moment when the injury occurs. So with today's video, I want to explain why that dynamic knee valgus position is so risky for structures located in the knee and what that person should expect when moving forward after this type of a diagnosis. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they are a little bit easier to understand. I also talk about the relevant anatomy for that injury and talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have dealt with an ACL tear and or a meniscus tear, go ahead and comment in the comment section below on your experience. We can see here on the injury replay that as Zapata is running, he's going to plant with that left leg, and as he does this, we see that knee cave inwards, and once again, that risky dynamic knee valgus position that I'll explain in a few moments. And as he does this, that knee buckles and we see him fall to the ground. Here is a model of the knee joint, and so the knee is formed by this femur, also known as the thigh bone, that's going to come down and form the top portion of the knee here. The bottom piece is going to be formed by this shin, also called the tibia bone, that's going to come up and form the bottom. Then on the side here, we have another long bone known as the fibula. There are four major ligaments that are located in the knee that contribute to the overall knee stability. The first one and most relevant ligament for this video is the anterior cruciate ligament, also known as the ACL for short, located right here. Then as we flip the model medially or towards the inside portion of the knee, we have the medial collateral ligament, or the MCL for short. As we flip the model laterally or towards the outside, we have the lateral collateral ligament, or the LCL for short. And finally, as we flip the model to the back here, we have the posterior cruciate ligament, also known as the PCL for short. These two blue structures that are located within the knee joint here are the medial and the lateral meniscus. These basically are pieces of fiber cartilage that are going to be cushions between the femur and tibia bones. Now let's go ahead and talk about why this is such a risky position for the knee. So when we are talking about a dynamic knee valgus, a few things are happening at the leg. The first one, we see that knee is going to cave inwards. Simultaneously, what's happening here is there is an eversion position of the foot, or some external rotation of the lower leg. And you can see as I do this and take the model into more of that, where that knee is going to cave in with rotation, this is stretching many structures that are located in the knee, specifically that ACL, because the ACL has two major functions. The first function of that ACL is to prevent any sort of anterior translation or frontal slipping of that tibia away from the femur. It also plays a major role in rotational stability. So when you're getting a major rotational force going through the knee, if that force is great enough, it can lead to a tear of the ACL. Now let's take a closer look at the injury video, because it looks like we see the exact moment when that ACL occurs. We see right here that as he plants, it looks like that bottom portion, including the tibia, is going to slide slightly forward and then come back and lock into place. We see this a lot with these non-contact ACL injuries because, once again, that ACL is preventing this anterior movement of the tibia, and once it has been ruptured, what's going to happen is it's going to slide forward because it's unstable now, and then it will kick right back into place because of the other intact structures. Another component of this injury that I talked about briefly is the fact that he is dealing with a meniscus tear. As of right now, I have not seen whether or not it is a medial or a lateral meniscus tear. Usually in injuries like this, we see a medial meniscus tear. However, the menisci that are located within the knee also get greatly strained when there is any sort of rotational force going through. There's actually a gold standard test that we do in the clinical setting. It's known as the Thessaly test. And so with this particular type of test, we have the person stand on one leg with a slight bend through their knee, and then we're going to have them rotate from side to side. And you can kind of see that that's going to make friction between both menisci on this model here. But in the clinical setting, when a person does this and that is going to reproduce their knee pain, maybe it's also accompanied by locking, catching, and or swelling, this makes us believe that the person is in fact dealing with a meniscus injury. Now let's talk about the test that we'll do in the clinic to help rule in an ACL injury, and that's known as the Lockman's test. If you've seen some of my other videos, you've heard me talk about this in the past, but what we're going to do for that Lockman's test is we're going to stabilize the person's thigh and we're going to pull that person's tibia coming forward. If a person has an intact ACL, and you can kind of see in the model here, but as I pull that forward, that ACL is going to stop it. And if the person is dealing with a rupture, that is going to obviously cause some instability in the knee, especially when it comes to anterior slipping. We're going to feel laxity. And so we do this and we compare it to the non-injured side. And if we essentially feel like it's moving excessively on the injured side, this is a way that we believe that the person is dealing with an ACL rupture. The gold standard for imaging is going to be that MRI, and this is where we get the grades of ACL injuries. There's grades 1, 2, and 3. In a grade 1, you're getting stretching, maybe some micro tearing of the ACL. In grade 2, you're getting what's known as a partial tear. And finally, in a grade 3, you get a full rupture. Unfortunately, in the case of a full rupture, the person is going to need a surgery known as an ACL reconstruction. And they're going to take a graft from either the person or sometimes a donor. And what they're going to do is they're essentially going to reconstruct a brand new ACL because the old one has been severed. Rehab after a surgery like this is a very lengthy process because it takes several months for that person essentially to heal and to build up stability in their quad muscle once again. In the initial phases of recovery, they're in something known as a drop lock brace, and this is a big brace that's going to span from the thigh going down to the ankle. And in some cases, you do have range of motion restrictions. It really depends on the severity of the injury. The other piece for this injury is that meniscus tear, and there are a couple options for this. Sometimes they will do something known as a meniscectomy, where they're going to cut out the damaged piece of the meniscus, or they're going to do a full meniscus repair. And whether or not they do the repair or not, that's going to influence the recovery timetable, because this is accompanied by more weight-bearing precautions, because since those menisci are going to cushion between the two bones, if you have repaired that, you have to make sure that the person is not putting body weight through that for a period of several weeks. It has not been released yet as to what they're going to do regarding that meniscus injury, but if I happen to hear anything regarding the updates on this particular case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So we wish Duvan Zapata the best of luck moving forward. Unfortunately, this is going to be a lengthy recovery timetable. Usually the ACL reconstruction rehab ranges anywhere from about 9 to 12 months, depending on several factors, how they do during their follow-up appointments, and some certain surgical precautions. So once again, if I hear those, I'll be sure to update everybody. But if you enjoyed this video today, thank you so much for watching. I'm going to go ahead and link one of my playlists so that you can watch some of the similar videos that I've done in the past. Thank you so much for tuning in again, and I'll see you.